You know that moment when you glance in the mirror and one of your eyes has that really unmistakable, vivid redness?
Yeah, it happens to so many of us.
It does. And today, that's exactly what we're unpacking. Consider this your sort of rapid route to really understanding red eye, using a great set of revision notes we've got.
Absolutely, because what seems like a pretty straightforward visual sign can actually stem from a surprisingly wide range of underlying causes.
All right.
So our goal here is to dissect that complexity a bit and give you a solid framework for grasping what red eye actually signifies.
All right, let's dive straight in then. When we talk about red eye, what are we fundamentally describing?
Well, in simple terms, red eye is just the appearance of a red or bloodshot eye.
Okay.
And this redness comes from the dilation or congestion of blood vessels in the conjunctiva.
The conjunctiva, that's the clear bit over the white.
Exactly, that clear membrane covering the white of your eye and lining the inside of your eyelids. Think of it as a sort of thin protective layer, also helps keep the eye lubricated.
So it's the surface showing the redness, not deeper down. And critically, this isn't really a diagnosis itself, is it? It's more like an alert.
Precisely. Red eye is a symptom. It's a signal that there's some underlying issue going on.
Okay.
And the range of those issues, the etiology basically, what causes it, is pretty extensive, which is why understanding the potential causes is so important.
Okay, let's get into those causes then. What are the main things that can lead to this redness?
Our notes highlight a really diverse list. Probably top of the list is conjunctivitis.
Right, pink eye.
Yeah, which can be infective, so bacterial or viral or allergic or even from chemical irritants.
Okay.
Then there's subconjunctival hemorrhage. That's just a broken blood vessel under the surface. Looks dramatic, often isn't serious.
Right.
Surprisingly, maybe dry eyes can also show up as redness. We also need to think about corneal abrasions or ulcers, uveitis, that's inflammation deeper inside the middle layer of the eye.
Okay, getting more serious now.
Yeah. Then there's acute glaucoma, a big one. Involves a rapid spike in eye pressure. Also a foreign body, actually, in the eye.
Ouch.
Blepharitis, which is inflammation of the eyelids themselves. And importantly, complications from wearing contact lenses.
Wow.
You'll notice a lot of these involve inflammation, right? Either of the conjunctiva or deeper structures. That inflammatory response is a really common pathway to the redness we see.
That's a really comprehensive list.
Yeah.
It definitely shows how one simple sign can point to so many different things, from, a speck of dust to something like glaucoma.
Exactly.
So who's more likely to get red eye? Are there specific risk factors?
Well, the risk factors, as our notes say, are varied and really depend on the specific cause we're talking about.
Makes sense.
So, for instance, with allergic conjunctivitis, obviously exposure to allergens, pollen, pet dander, that's a key risk factor.
Right.
Contact lens wearers definitely face a higher risk of certain infections and corneal issues that cause red eye. A recent eye injury is a pretty obvious risk factor for things like a hemorrhage or a corneal abrasion.
Sure.
And interestingly, even systemic conditions, things affecting the whole body, like certain autoimmune diseases, can sometimes present with red eye.
Oh, okay.
And just having had eye infections before can make you more susceptible later on.
So the takeaway is anything that irritates or damages the eye surface or messes with its protection can up the risk.
Pretty much.
That makes sense.
Yeah.
So if someone comes in with red eye and they wear contacts, that immediately flags up certain possibilities.
Definitely.
Now, let's go a bit deeper. What's actually happening physiologically in the eye to make it look red? The pathophysiology.
Okay, so at its core, the pathophysiology is about those conjunctival blood vessels we mentioned earlier, dilating or becoming congested.
Widening or filling up more.
Exactly. Think of it like this. These tiny vessels get wider, or more blood flows through them, and that increased blood near the surface becomes visible as that red or pink color.
Got it.
Now, the specific triggers for that widening or congestion vary a lot depending on the cause.
Right.
So in conjunctivitis, it's usually inflammation making the vessels stand out. In a subconjunctival hemorrhage, it's the actual rupture of a tiny vessel. So what we see more blood in the surface vessels is the same, but the why can be very different.
Okay, so the visual result looks similar, but the mechanism behind it can be quite different, which leads us to the differential diagnosis what doctors consider. With so many possible causes, figuring out the right one sounds crucial.
Absolutely crucial. The differential diagnosis is basically that list of all the possible conditions causing the red eye.
And it sounds like it overlaps a lot with the causes we just listed.
It does, yeah. It largely mirrors the etiology. conjunctivitis bacterial, viral, allergic, chemical subconjunctival hemorrhage, dry eyes, corneal abrasion or ulcer, uveitis, acute glaucoma, foreign body, Blepharitis, and those contact lens complications.
So the same list again, really.
Pretty much. Thinking about the location and the type of redness, plus any other symptoms like pain or discharge, helps narrow things down.
Okay.
The key thing is that a clinician needs to systematically go through these possibilities, considering the patient's history, their symptoms, and what the examination shows.
Like being a bit of a medical detective, piecing together clues.
Exactly.
Now, given how often people seem to get red eyes, do we know much about its epidemiology? Which causes are most common?
Well, the frequency really does depend on the underlying cause. But our notes do highlight that things like conjunctivitis and dry eyes are definitely very common in the general population.
Right, you see those a lot.
Yeah, in fact, conjunctivitis is a really frequent reason people seek ophthalmic care, so it's certainly prevalent.
Okay.
The other causes might be less common overall, but they're still really important to keep in mind, especially if the picture doesn't quite fit simple conjunctivitis.
Right, so don't just assume it's pink eye. You need to rule out the other possibilities. So if someone comes to you with red eye, what symptoms might they actually describe? What does it feel like?
The clinical presentation, how it looks and feels, can vary quite a bit depending on the cause, but there are common themes.
Okay.
Redness of the conjunctiva is obviously the main thing. People might also talk about eye discomfort or irritation.
Like a grittiness?
Yeah, a foreign body sensation, like something's in there. Also tearing, maybe discharge could be watery, could be thick and purulent. Itching is a big clue, often points towards allergic conjunctivitis.
Right.
Blurred vision and photophobia, that's sensitivity to light, finding bright light uncomfortable. Those can also happen and might suggest something more serious is going on.
So it's the whole package of symptoms, not just the redness.
Exactly. It's the specific combination of signs and symptoms that helps point towards the right diagnosis.
So when someone presents like this, what investigations would a healthcare professional typically do?
Well, the foundation is always a thorough eye exam.
Okay.
That usually starts with checking visual acuity, how well can the person actually see.
The chart test.
Right. Then a slit lamp examination is really crucial. That's using a special microscope with a bright light.
The one you put your chin on.
That's the one. It gives a really detailed view of the front of the eye, conjunctiva, cornea, other structures. The examiner looks closely at the pattern of redness, too.
Okay.
Assessing the intraocular pressure is also important, especially to rule out things like acute glaucoma.
Right, the pressure test.
And if an infection is suspected, say there's purulent discharge, then cultures or swabs might be taken to identify the specific bug.
So a good look at the eye is usually step one. Now let's talk treatment. How is red eye typically managed?
Management is all about treating the underlying cause. That's the key.
Makes sense.
So if it's bacterial conjunctivitis, you'd use antibiotic eye drops or ointment. For allergic conjunctivitis, maybe antihistamine drops or tablets. If it's dry eyes, then artificial tears, lubricants are the main thing.
Right.
Our notes also mention general relief measures, things like topical lubricants for comfort, maybe vasoconstrictors to temporarily reduce redness by narrowing the blood vessels.
Although they don't fix the cause.
Exactly, just mask it sometimes. And antihistamines for itching. But fundamentally, you need to identify and address the root cause, like irritants or poor contact lens habits.
Okay, treat the cause. But it sounds like some red eye situations are much more urgent than others. What are the absolute red flags, the things that mean get this person seen by a specialist now?
Yes, this is super important. Our notes have a clear list of urgent referral indications. You really need to know these.
Okay, hit me.
Right, so acute glaucoma, moderate to severe eye pain or photophobia, marked redness just in one eye, ciliary injection that's redness concentrated around the cornea.
Okay, deeper inflammation.
Yes. Reduced visual acuity, seeing colored halos around lights, big glaucoma sign, copious purulent discharge, especially in newborns.
Right.
Any suspicion of a corneal laceration or a foreign body actually in the eye or on the cornea, particularly an ulcer linked to contact lenses.
Contact lens ulcers are bad news.
Very bad. Also, known or suspected eye trauma, signs of endophthalmitis, that's infection inside the eye, maybe after surgery. Any distortion of the pupil or abnormal reaction.
Okay.
Signs of herpes simplex or zoster affecting the eye, neonatal conjunctivitis or recurrent episodes, proptosis where the eye is bulging forward, and, as we mentioned, if the person wears contact lenses, that often warrants a lower threshold for referral.
Lots to remember.
And a really critical one, chemical burns. Immediate copious irrigation is the first step, then referral once the pH is stabilized. There's a helpful mnemonic. Painful red eye.
Okay, painful red eye. Let's hear it.
Pain, moderate to severe. Altered vision, reduced acuity. Intraocular pressure increased, signs like halos. Neonatal copious discharge. Foreign body or trauma. Unilateral marked redness or ciliary injection. Lens-related ulcer.
Painful red eye. That's brilliant. Really covers the big scary things. Okay, so that's urgent. What about things that need attention soon, but maybe not immediately?
Good question. The notes also mention referral within 24 hours for conditions like anterior uveitis and scleritis.
Still serious inflammation, but maybe not quite the same immediate threat.
Generally, yes. And for things that don't fit into either the urgent or 24-hour categories, management can usually happen appropriately in primary care.
Okay, so there's a clear triage system based on symptoms. What about the long term? What's the prognosis usually like for red eye?
Well, again, it really depends heavily on the underlying cause.
Of course.
Many common causes, like, say, viral conjunctivitis, are often self-limiting. They'll get better on their own, though treatment can help with symptoms.
Right.
Others, like bacterial conjunctivitis, usually clear up fast with the right antibiotics. Okay. But the more severe conditions we've mentioned, uveitis, corneal ulcers, they can have a more guarded prognosis. They might need more intensive, longer-term management.
And can there be lasting problems? Complications?
Yes. Complications can definitely occur, and again, they depend on the cause. You might get chronic conjunctivitis that lingers. Corneal scarring is a risk after abrasions or ulcers, and that can affect vision.
Permanently?
Potentially, yes. In severe cases, or if treatment is delayed, vision loss is possible. You can also sometimes get secondary infections on top of the original problem.
Okay.
And then, of course, specific conditions like glaucoma or uveitis have their own potential long-term complications if they're not managed properly.
So it really highlights why getting the right diagnosis and treatment promptly is so important to try and head off these complications.
Absolutely. Timely and appropriate management is key.
So wrapping up, the main message seems to be, red eye is common, yes, but don't just dismiss it. It can signal a whole range of things, some minor, some needing urgent care. It's all about looking at the bigger picture, the other symptoms, the history, how the eye actually looks.
Precisely. Red eye. Common symptom, remarkably wide range of causes, from simple irritations right up to sight-threatening emergencies. Careful assessment is vital to figure out the cause and guide treatment.
And knowing those red flags for urgent referral is absolutely critical.
Couldn't agree more. Knowing when to act fast can make a huge difference.
Fantastic. This has been a really, really useful deep dive into red eye, a great high-yield overview for anyone revising this topic. And for those of you listening who want to explore more or need revision resources, definitely check out passendsra.com and freemsra.com.
Definitely good resources. And maybe one final thought to leave you with. How might a seemingly isolated symptom, like red eye, sometimes be the first clue to a more widespread health problem going on elsewhere in the body?
Yeah.
It's a good reminder of how interconnected everything is.